Dr. Galal, it has been a very fine discussion on this targeted and precision medicine and all this paradigm changing, exciting time in the management of classic Hodgkin's lymphoma. So what are the other advances you think that we are seeing in 2019 for relapsed refractory Hodgkin's disease and improving the efficacy and decreasing the toxicity and improving the outcome for patients in the coming years?
So as we mentioned at the beginning, the more research in the earlier stage classical Hodgkin's lymphoma would be really important, so we can try to replace the bleomycin with the brentuximab vedotin in this population, and we make sure it's valid in terms of effectiveness and safety profile, which I think it would be given the data that we have in the advanced disease. So that would be one area. The other area in the peripheral T-cell lymphoma, the more use of what we're doing right now and using brentuximab vedotin and lower percentage of CD30 might be very helpful in defining the effectiveness of the drug. So the other possibility in treating classical Hodgkin's lymphoma using checkpoint inhibitors that's been showed to be very effective, especially in combination with brentuximab vedotin. Currently, it is approved in the relapsed refractory Hodgkin's lymphoma. Therefore, it opens the door for treating these patients and get them into complete remission so they can make it to transplant or even continue to be monitored and treated with these kind of combinations. Bempro as well has been used in the classical Hodgkin's lymphoma and led to a very effective profile and very safety or very safe kind of profile as well. So it's valid to use the checkpoint inhibitor in this kind of situation. mTOR inhibitors and HDAC inhibitors has been tested in this arena, and there are certain situations that might be effective. I would basically favor to use checkpoint inhibitors before considering these kind of agents. Next research questions need to be answered would be the earlier stage Hodgkin's lymphoma and effectiveness of brentuximab vedotin and safety profile. Adding to that, taking the bleomycin away, what the impact of the bleomycin toxicity on these patients, especially most of them are very young patients. So that would be a very important question to answer. One of the other questions is the positivity or negativity of the CD30 and its impact on the response for the brentuximab vedotin. I think would be very important that we know exactly what does it mean and does it work or not. Basically, the mechanism of action to be more defined with other ways of mechanism of action. For instance, the rupture of the cell and affecting the tumor environment more. That would be a very good idea to help with a low percentage of the CD30 used in this kind of population.
Thank you, Dr. Galal, for this insightful discussion, and thank you to our audience for watching this targeted oncology presentation on precision medicine.